You're watching Iowa Live. Everything local, entertaining, and meaningful in Central Iowa is right here on Iowa Live.
From the Carl Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou, and it is time to visit with someone we always have a great time talking to. It is Dr. Josiah Fitzsimmons from Vero Neuropathy. Dr. J, good to see you.
Thanks for having me.
All right, now we want to do something here. We want to shed some light on neuropathy for somebody who might be watching right now, Dr. J, who thinks they might have this debilitating conditions. How would somebody know?
Absolutely. Lou, the first thing would be come in our office so we can do a full initial evaluation. We actually do 8 different individual tests, calculate the exact percentage of sensory loss. So if you have numbness, tingling, aching, burning, shock-like sensations in your hands, legs, or feet, those are all typical symptoms of neuropathy. Once someone gets over 80% nerve damage, typically the condition cannot be fully reversed. So if you have any of these symptoms on the screen, numbness, tingling, muscle weakness, prickling, sensitivity to touch, you touching things with your hands, stepping on things with your feet, even the sheets of your own bed starting to cause additional pain, then those are all signs of neuropathy.
So instead of just letting it go by, as Dr. J mentioned, come on in, and we're going to let you know about a great special they have coming up in just a little bit, but come on in. But what happens after they come in and after you have a chance to take a look at it?
Absolutely. So first we do those 8 different tests, Lou. We want to calculate the exact percentage of sensory loss in the hands or fingertips. And then we want to figure out exactly what sensory loss it's at and come with an individualized game plan. For some people, depending on how the neuropathy got there, it could be more of a blood flow issue. For others, it's more of a nerve supply problem. For other people, it's an inflammatory problem where they have chronic levels of inflammation that's causing that deterioration.
So it's a bunch of different things, but you can determine what it is.
Exactly. That's the big thing. For most people with neuropathy, they just take a cookie-cutter approach. They get prescribed gabapentin, Lyrica, Cymbalta, or even just dangerous opioids just to mask the condition of neuropathy, whereas we want to do very individual tests, figure out exactly what's going on, come with a personalized game plan to help people get their life back.
Okay, you have a game plan now, so what are we doing then? So what are some of the treatments that are involved here?
Absolutely. So the first one is we use what's called low-level light therapy. We need to use a process called angiogenesis. Big fancy word. All it means, Lou, is a recreation of the blood flow and the blood vessels and the arteries.
Yeah, here's part of it here. Okay.
Exactly. That's one of the pieces of equipment there that actually helps, like I said, improve the blood flow into the areas. The next piece of equipment that we have actually helps recreate that coating around your nerve, or what's called in science is called the myelin sheath. That's the insulation for your nerve. That's why you're getting all those numbness, tingling, burning, shock-like sensations, because your nerve is exposed to the inside of your body because that nice rubber coating is starting to deteriorate. The next thing we want to do is address the inflammation in your body. When you have high levels of inflammation, that contributes to that deterioration of the nerve. Your brain and body can't communicate the way it's designed to. And then we really want to work on the nerves throughout the whole body. If we only work on your hands or we only work on your feet, you're just going to get short-term relief. And we want to get long-lasting results, so we want to check the nerves throughout your entire body to make sure they're all functioning properly.
And notice you did not hear him say medication, because he's not going to give you drugs or injections or anything like that, because there are side effects to medications. And we have a bunch of them that we want you to take a look at. These are just some of the side effects from some of these dangerous drugs.
Absolutely. We've all seen the commercial where it says it helps with one thing, and then there's someone speed talking for 2 minutes with all the potential side effects. Unfortunately, very, very similar, with neuropathy. It may give you some temporary relief, which is absolutely needed, but then you get all these additional side effects. So if we can work with your body the way it was designed to. I always tell people, God didn't make a mistake when He made our body. Our bodies know exactly how to heal. We just need to unlock that communication, get the nerves to relay messages properly so your body can heal. Like I said earlier, once someone gets over 80% nerve damage, Lou, that's typically when it can't be fully reversed. So it's so imperative to get on top of neuropathy sooner than later. It's a progressive degenerative condition. It's just going to get worse and worse, harder and harder to do anything about.
Okay, and some people want to make sure that you realize, even though you may have heard otherwise, yes, neuropathy can be treated, and Vero can treat your neuropathy. And right now, they have a deal going on. Seriously, you really need to take advantage of this, because for $37, you can find out whether or not you have neuropathy. You may not have neuropathy. They will tell you.
Yeah. I mean, honestly, Lou, it's almost too good of a deal. We had someone that called in from, hey, saw you on Iowa Live. I don't even believe you. There's no way you're going to do 8 different tests, meet with me one-on-one with the doctor, verify my insurance. We're in network with Medicare, United Healthcare, Blue Cross Blue Shield, do all the 8 different tests, figure out exactly what's going on, come up with a comprehensive game plan for only $37. It's kind of a no-brainer, but it's only for the first 25 callers. So we have limited spots in our one location in West Des Moines. Right now, Lou, we have people that are traveling 5 hours one way, to our location. So give us a call as soon as possible. 515-335-8376, which is Vero. 515-335-8376. Only $37 to get all those 8 tests done. Meet with one of the doctors, verify your insurance, see exactly what's going on, come up with a whole individual, that's the key, Lou, individual game plan depending on what you have going on.
All right, we call right now. How long before we get in?
Usually we get people in within 24 to 48 hours. We have 9 doctors in our one clinic.
That's awesome. See, I didn't even have to say the phone number. He did. See, we have you trained. That is good. So I'm going to say it anyway. Here's the number one more time, 515-335-VERO, V-E-R-O. Get a hold of this guy and his incredible staff and say goodbye to your neuropathy pain. Thank you so much, Dr. J.
Thanks for having me.
When we come back, we're going to show you the stars that are going to be coming out at the Marion County Fair starting tomorrow. That's next on Iowa Live.